Okay, my name is Ramazan ERDEM. I am an associate professor doctor in Textile Technologies Department of Akdeniz University. My presentation is related to medical and hygiene textiles. First of all, we can say that we can produce the medical and hygiene textiles by getting benefit from different textile materials such as fibers, yarns, woven fabrics, knitted fabrics, even braided and non-woven ones. Of course, if you look at the material firstly, we should just concentrate on the properties of the polymer types, because the polymers used in medical textiles field are different from the polymers used in traditional textiles. So the important characteristics of polymers can be stated as non-toxicity, non-allergenic response, the ability to be sterilized, good mechanical properties, strength, elasticity, durability, and biocompatibility. We can see on this slide that there are some specific products, especially fiber types: cotton, viscose, polyester, polyamide, polypropylene. These are the most used fiber types in medical and hygiene applications. And also we can see some end products such as surgical gowns, caps, masks, surgical hosiery, some kind of protective clothing, etc. And in the case of the properties and requirements of healthcare and hygiene products, we should say that these kind of products should, play some important roles about establishing hygiene environment and care environment. Also, they are used for the safety of the staff and patients in hospital area. These are some surgical gowns, caps, masks, patient drapes, and cover clothes are the mostly used ones in this field. So contamination level is very important in those kind of products. So these kind of products should clear the contaminations and also prevent the transfer of this contamination from the hospital environment to the patient or doctor's body. For example, if you talk about the non-woven products, they can be mostly disposable ones in these fields. So cost reduction in the case of non-wovens can be easily stated, and they are consisting of only fiber production and entanglements of these fibers inside of their structures. So we are basically eliminating the yarn production stages. So these products are cheap and mostly single-used ones. And of course, there are some other requirements, such as high filter capacity, high level of air permeability, lightweight, and non-allergic structures are the mainly properties that we require from the healthcare and hygiene products. Also, these kind of products should be antibacterial and antimicrobial and absorbent enough to absorb the fluids such as wound exudates. And in order to obtain some multifunctionality and specific properties, we can just apply some finishing techniques to these medical and hygiene products and fabrics. We can use different methods to get functional properties of these products. And on this slide, for example, we can see some examples of healthcare and hygiene products. and fiber types, and the fabric types to produce all these products mainly. And in the case of medical textiles, we can divide this category into two different parts. One of them is non-implantable materials. The other one is implantable materials. In the case of non-implantable materials, we can say that these materials are used for external applications on the body, and they may or may not make contact with the skin. And there are actually 5 main groups we can give example out of it. For example, primary wound dressings, absorbent pads, bandages, protective layers, adhesive layers, etc. And these are again the products, fiber type and fabric type of these specific groups. And we can see mostly woven, knitted, and non-woven fabrics are used. And absorbency, of course, another important parameter for when we produce such kind of products. And as you clearly see from the table, that cotton, viscose, mostly cellulosic-based products are used for the absorbency applications. And they are required to possess the following properties, basically. For example, healing properties. And they shouldn't cause any mechanical injury, especially in the granulating wound area. Low adherence is another important parameter. Stable spatial structure, easy penetration of wound exudate into the absorbent dressing, painless changing of the dressings are very crucial, especially during the healing stages. There are some big commercial and global companies on the market. So Smith & Nephew, KCI, Johnson & Johnson, Human Genome Sciences, Paul Hartman are some of the very well-known companies in terms of producing wound dressings. And if you just look at the amount worldwide, we can see that the wound care market is estimated to be worth 6.7 billion worldwide. And in the United States, for example, approximately 6.5 million people suffer from chronic wounds. So it's a growing and developing market, actually. Wound dressings should, have some important characteristics, and when we just design and produce wound dressings, we have to concentrate on some specific properties such as absorption, porosity, capillarity, strength, extensibility, flexibility, drapability, air and moisture permeability, availability in the three-dimensional structure, variety on fibers or filaments, types and lengths can be used. Fineness is another important property. Cross-sectional shape and geometry is critical. Manipulability to incorporate medicine, etc. Some of the crucial characteristics when we design the wound dressing structure. So mostly preferred textile materials are, as we previously mentioned, fibers, slivers, yarns, woven, non-woven, knitted, crochet, braided, embroidered fabrics, composites, and in last years especially we see that some electrospinning and electrospan nanofibrous materials applications. Apart from this, there are some specific structures like hydrogels, tissue engineering specific matrix types, films, hydrocollates, and foams can be given some specific examples related to this field. Ideal wound dressings should possess the following properties as well. For example, being a barrier to microorganisms to protect against infection. Create clean and moist environment in the wound bed for fast healing, and especially if you create and establish a kind of moisture environment in the wound bed. We see in the literature that at the end of the healing process, we can get a better cosmetic appearance on the wound area. So they should provide some thermal insulation and comfort as well. They should protect exposed nerves to diminish associated wound pain. For example, in that situation, we can change the polymer type we use during the production to get this effect. For example, Chitosan is a suitable material to diminish the wound pain in the wound area. And at the end, of course, we can get again the cosmetic appearance, better cosmetic appearance. And they should eliminate dead space within the wound bed to prevent premature wound closure, remove debris, provide adequate gas exchange between the wound and the environment. It is very important, and this oxygen and carbon dioxide transfer from the cells. Being easily removed from the wound surface without causing any trauma during healing. Being able to manage exudates and fluid without causing maceration or irritation. Provide, of course, cushioning effect in the case of external force applied to the wound area by coincidence. Being compatible and non-toxic, non-allergic, non-irritating, and biodegradable if it is necessary. And cost-efficient production type also is demanded. Able to be manufactured and used easily is another important property. These are some wound types. The wounds can be, necrotic wounds, granulating tissue wounds, epithelializing wounds, infected wounds, and all these wound types require different kind of wound dressing materials. So these are, the healing phases of the wounds in a normal wound healing stages. For example, it starts with hemostasis and continues with inflammatory phases, proliferative phases, and lastly, remodeling and maturating phases occurs. And these are some examples of manufacturing techniques of wound dressings. Firstly, we should talk about the weaving structures. We use lino weaving technique to produce the wound dressing structures, and we usually coat these weaving structures with paraffin at the end. And these are some examples of companies and brands. And on the right hand side on the table you can see the description and properties of these products as well. These are some very well known companies you can see. And knitting is another technique. Knitting structures are generally more elastic and flexible compared with the woven fabrics. So if the extensibility and dimensional instability are required, we can use also knitted products instead of woven products. And this is one of the examples of patents on the market. As you can see, some blue and red yarns inside of these structures. Actually, these blue yarns are the stable yarns and structural yarns in this wound dressing, and the red ones are the yarns who have the properties to be getting gelled during the application in the wound area. This is a specific example of wound dressing example. And the other one is the spacer fabric, and this is another example specifically I would like to give, because if you just look at the structure carefully in this picture, you can see that there are two layers, bottom and up layers, and these layers are connected to each other with the pile yarns just in between, and on the top and the bottom the researchers coated this structure with electrospun fibers. So this top layer is made of electrospun waterproof film, nanofibrous film with air permeability property, and hydrophobic surface of spacer fabric knitted with synthetic and elastic yarns. And if you look at the middle side of the structure, you see highly absorbent spacer layer with good liquid retention, composed of absorbent yarns. Hydrophobic wound contact layer with rapid liquid transportation and good permeability, composed of synthetic and elastic yarns. So basically in the end we can say that this product can be successfully used to cover the surface of the wound. Also it may allow in a satisfactory level that waterproof, water vapor and air permeability can be established in a satisfactory level. And this is another embroidery technique. This was applied in the Switzerland. This is one of the examples from one of the researchers' dissertation actually, and this is used specifically to produce wound dressing structure basically. I would like to talk about a little bit non-woven structures when we produce wound dressings. You know, they are soft and they have soft and resilient hands. Absorbing characteristics are quite good, and they have the ability to retain the exudates, and also they can be used as a protective covering successfully. And they are more homogeneous comparing with the other materials, softer and more resilient, as I said. And you can choose any type of fibers to produce wound dressing non-woven structures and different bonding techniques. Fast and economic forming the web by assembling or laying the fibers is the first step, and the second step is the bonding of this web. As I told you before, there are different techniques you can apply. And these are some techniques basically: needle punching, adhesive bonding, thermal bonding, stitch bonding, felting, hydro entanglement, and spin laying are some of the very well-known non-woven production methods, we can say. In the web forming, it can be parallel laid. I'm talking about the laying of the fibers. Also, cross-laid web forming technique can be applied. These are some techniques. I need to just go through it fast because of the limiting of presentation time. This is another mechanical technique. We call it needle punching technique. And chemical and thermal bonding of webs are also used in specific fields. Spun bond process is another well-known technique. If you want to just produce non-woven products with soft hands and voluminous products, you can apply spun lace or The other name is hydro entanglement process as well. And this is the novel technique. It has become very popular, especially in the last 2 decades. Is the electrospinning. It is actually basic and versatile technique that you can produce nanofibers at submicron range, and you can use these fibers by getting benefit from the electrostatic forces. And I'm not going to go in detail of this project production style, but I can give some examples of the product's name and the companies, and of course some properties of these products. And when you produce wound dressings, you can get benefit from specific type of fibers. Alginate fibers are maybe the most used ones for exudating wounds, and it has really high absorbency capacity, and we can use calcium alginate fibers. And when a water insoluble calcium alginate fiber is in contact with wound exudates, the calcium ions exchange with sodium ions in the body fluid, and calcium ions release. So in this case, of course, calcium ions can act as a hemostatic agent. When in contact with the wound, calcium alginate fiber slowly turns into a sodium alginate fiber. Then it starts to absorb a large quantity of exudates and turns itself into a gel, which helps keep a moisture interface on the wound surface. These are some basic examples of alginate-based wound dressings. We can see them quite often on the market, actually. The names are algicide, algosteril, Chitosan. These are the most used ones, we can say. Chitosan is another interesting option for producing wound dressing materials and applications, and it is highly antibacterial, and it can be used as an hemostatic agent when we put them inside of the wound dressings. Yes, my presentation is quite long actually related to this topic, and I would like to just cut my presentation over here to effectively finish my presentation. Thank you very much for your attention.